Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Ruth Cabal, sitting in for Pinky Webb. Today on the program, after drawing criticism on the 500 peso daily allowance for volunteer health workers, the health department says they're sorry. Philippine Medical Association Vice President Benny Atienza joins us live. From mobile markets, automated contact tracing system, to isolation facilities on standby, Valenzuela City Mayor Rex Gatchalian takes their COVID-19 fight to another level. And the medical staff of the hospital in Laguna gives a heartwarming tribute to their first COVID-19 patient who recovered from the coronavirus. The health department promises to take better care of volunteer health professionals. Officials are apologizing for offering a 500 peso daily allowance to medical volunteers in the health crisis. Labor group Defend Philippines calls this an insult to frontliner volunteers. Health officials admit adjustments need to be made.
Makakatanggap din po sila ng COVID-19 Special Risk Allowance bukod pa sa hazard pay na makukuha nila sa ilalim ng Magna Carta for Public Health Workers. Sila rin ay makakatanggap ng Transportation Allowance. Sakasakaling sila ay mahawa sa sakit na COVID-19, sasagutin po ng PhilHealth ang lahat ng kanilang gastusing medikal. Sakaling ang kanilang kondisyon ay maging kritikal, sila ay makakatanggap ng 100,000 pesos. At nawa ay hindi naman po mangyari, ngunit kung sakaling sila'y pumanaw dahil sa sakit na ito, makakatanggap po ang kanilang pamilya ng 1 million pesos na compensation.
Volunteers will be assigned at the Lung Center, Philippine General Hospital, or Dr. Jose N. Rodriguez Hospital during their 28-day engagement. They will work 8 hours a day for 14 days straight. After that, they have to undergo mandatory quarantine for the next 14 days. Let's go straight to the source of the story, Philippine Medical Association Vice President Benito Atienza. Good morning, Dr. Atienza, and thank you for taking our call. We want to start with getting a PMA's statement on the flight which caught fire last night, where 8 people were killed at the NAIA, including a doctor and several medical personnel. Can we get your statement, Dr. Atienza?
The whole Philippine Medical Association extend our solemn condolences to the family of one of our doctors named Ricardo Nico Bautista during the plane crash last night. Actually, she was assigned to early to one patient coming from the province. The patient requested to another hospital in Japan because the patient came from the hospital that treated the patient.
Dr. Atienza?
Yes?
Yes,
Yeah,
okay.
go ahead.
Hindi lang po namin narinig yung latter part ng inyong statement. You were saying that the patient was supposed to be brought to Japan and then nag-request po ng, ano po ito, Doc?
The patient was to be transferred to Japan kasi meron daw, there is a COVID patient in the previous hospital where the patient was admitted. So, kasi pagka may sa-transfer tayong patient, dapat may isang doktor doon, may nurse na mag-a-assist. Unfortunately, the crash happened in NAIA last night. I think it's 8 o'clock.
Dr. Atienza, ibig po sabihin, hindi po COVID-19 patient yung nakasakay po doon sa eroplano?
I think so.
Yes, doctor, so you were saying na ang binigay po na pangalan for the doctor, no, si Dr. Nico Bautista of PLM because they were already issuing statement. Opo.
Yes.
And then the others are
The passengers were one flight attendant, one nurse. The doctor is Dr. Nico Bautista, and 3 flight crew, 2 pilots and 1 crew, 1 patient, and the patient or the patient assistant.
Yes, Doctor. Isa rin pong mainit na issue is about what we reported earlier about yung binibigay po ng Department of Health. They issued a call for medical volunteers and they were saying na they will give 500 pesos daily allowance to these volunteers. One group is even saying it's an insult daw dahil napakababa ng amount. What's your reaction to that, Dr. Atienza?
Actually, marami nag-react doon na mga doctors and the health workers. And that's why there was a proposal to have, kasi kinukulang na yung mga doktor, the Philippine Medical Association will be having a meeting with DOH and the Federation of Private Practitioners, and together with the Department of Health and each task force, yung task force natin, the interagency task force, and they will have a meeting this Tuesday siguro. There was a proposal of the Philippine Medical Association for the second wave frontliners. Ano itong second wave frontliners? Ito yung posibleng pumalit sa mga doctors at saka sa mga health workers nang for the last 3 weeks napagod na sila. And the objective is to organize the second batch of frontliners who would relieve the services of the present frontliners, physicians against COVID-19, and to formulate plans of action to prolong fight against COVID-19, and to assure professional and strong workforce capable of medical services for all Filipinos. This is the main objectives of this meeting proposal. Because of the Philippine Medical Association, we have about 30. More than 48,000 active members. Pero hindi naman to lahat nasa hospitals. Hindi to nasa academe, within the others are in the industrial medicine. We have different and marami pa rin kami mga doctors na hindi pa member ng Philippine Medical Association. These are the new graduates and hindi pa nagtitraining. And the creation terms, there is a creation terms of reference for the second wave physicians. We have the inclusion, exclusion criteria, the length of service, the classification of service, and most important here in the negotiation is the incentive for the doctors. This is the part of the doctors. Iba pa po yung sa nurses, iba po yung sa ibang health workers.
Dr. Atienza, you also mentioned na members din ng PMA itong mga new graduates and other yung mga bago pa lang po. Kasi there's also a proposal na i-deploy na rin yung mga hindi pa nakukuha yung license nila or even meron pa nga po akong narinig na even retired doctors para po tumulong dito sa fight against COVID-19. Pwede po bang gawin yon? Are they, even like the new graduates, are they fully capable already or pwede na silang isabak sa field?
Actually, basta MD ka naman, ito yung natin, magkakaroon naman sila ng supposedly short training pag yung proposal. Then ang namin kasi is the length of service at saka inclusion, dapat actively in practice sila, physically, emotionally, and spiritually able. At i-verify namin through PRC kung talagang sila yung doktor, and especially volunteerism nila at saka willingness to serve. Yun lang naman yung namin eh. Kasi kailangan kasi may guidance din sila at saka yung training.
Dr. Atienza, also we know that several doctors have died while helping COVID-19 patients. Maybe you can give us an update later. But among the frontliners who passed away during the COVID-19 war are Pampanga Health Chief Dr. Marcelo Hauchico, cardiologist and internist Raul Hara, cardiologist Israel Bactol of the Philippine Heart Center, anesthesiologist Gregorio Macasaet of Manila Doctors Hospital, and oncologist Rose Pulido of the San Juan de Dios Hospital. The Private Hospitals Association of the Philippines, or PHAPI, says the doctors were exposed to the virus due to inadequate protective gear. PHAPI President Dr. Rustico Jimenez says these deaths could have been avoided if the Philippines prepared before the pandemic hit. The group is also appealing to the public to donate more protective gear to hospitals.
Yes, we support that statement of the PHAPI. It's one of the reasons kaya sila. And another reason is yung mga pasyente natin, they don't give the right history. Kasi especially the travel history, ano nararamdaman nila. Because of the diagnosis is based on 80% on the history and physical examination. Yung 20% is based on our laboratory test.
Yung sinasabi din po, sir, ng inadequate protective gear, kamusta po ang monitoring nyo? Kasi the DOH is saying they're trying to procure this already. Even yung National Task Force on COVID-19, yan din yung ina-assure nila na may mga orders na sila. So ano na po ang status ngayon nitong mga protective gear for medical personnel?
Pakikon yung nakalagay, medical guards may be deployed depending on their training. Ito yung sinasabi nating pasado ng PRC. Ito yung real doctors. Kasi pag medical graduates, they will undergo internship, 1-year internship. And after their internship, they will take their board examination.
Yes, sir. Last na lang. Okay. Last na lang, Doctor, kasi the DOH also issued a statement denouncing yung physical assault, harassment, and other forms of discrimination against medical personnel. Yung iba nga daw po pala, may reports pa na tinatapunan ng bleach or chlorine. May natatanggap po ba kayong reports? And ano po yung appeal nyo to the public?
Actually, actually here in our town, our district hospital was closed and nababash at saka
wala nang DOH
sila, yung mga nurses, yung aming ibang staff, natatakot umuwi kasi parang segregate sila sa community. Kasi once nagaling ka sa COVID hospital, may nag-positive, natatakot na yung mga barangay na tanggapin sila uli. What we did is that we isolated the staff of this hospital to this hospital para disinfect yung hospital. Then lahat ng staff sila ay naka-quarantine doon sa hospital. Kaya sabi ko, the hospital supposedly for the patients ngayon for their staff, medical staff and nursing staff. Yan ang nangyayari ngayon. And we hope that the government provide shelter for our frontliners kasi ang iba dyan, hindi nga nakakabalik na sa kanilang bahay kasi kailangan na nilang, there are supposedly the PUM. Kung may symptoms na, PUI na yan. Persons under investigation. And we want this na ma-house sila sa malapit na like in Manila, sana sa provinces gano'n din, may mag-offer ang government ng isang housing or dorm para sa ating mga health workers para hindi na sila uuwi sa kanila, para hindi sila nagbabas. What happened in Baguio, diba, sa phase 5 yung nag-iisa siya, then this staff, dumaan lang din, then sinabuyan siya ng Clorox sa buka. And other
That's very unfortunate, Doctor. Doctor, kunin ko lang ulit, ilan po yung update nyo? Sorry, Doc. Ilan po yung update nyo dun sa mga doctors po na namatay and number of personnel under PUM or PUI?
We don't have the numbers for yung health workers. Ang inaalam na lang namin palagi yung sa doctors kasi we want the media to give privacy to our doctors kasi may nagreklamo dyan, napasama siya doon sa COVID patients na who died. Pero yesterday, the official result of their COVID testing is negative. To the media, please take her out in your list kasi this is a privacy. We want to give privacy to the family in the time of grief kasi
Okay.
masyadong naano pati yung pamilya. Then we request na don't mention the names. Kasi the Philippine Medical Association has no right to give the full details of this,
Okay, Doc.
and only the DOH can give their status kung COVID positive sila or negative. Kasi ito yung nagiging problema natin kasi
Yes, Doctor.
kasi nagiging napakasakit na sa family. Especially
Yes,
kung
Doctor.
hindi naman
Okay.
siya COVID.
Thank you very much.
COVID.
Thank you very much to Dr. Atienza of the Philippine Medical Association. You're watching The Source on CNN Philippines. Valenzuela City gears up for the possible influx of COVID-19 cases in its city. Mayor Rex Gatchalian tells us more after the break. And we show you a story about how this medical team in a Laguna hospital honored their first patient who recovered from COVID-19. Keep it here on CNN Philippines. You're watching The Source on CNN Philippines. Local government units are launching their own initiatives to combat the coronavirus disease, or COVID-19. Among the list of cities praised by netizens for its efforts is Valenzuela City. Let's go straight to the source of the story, Valenzuela City Mayor Rex Gatchalian. Good morning, Mayor, and thank you for taking our call. Can you just give us an update first on the COVID-19 cases in your city, sir?
Good morning, and good morning to everybody who's watching your program as well. Right now, we have 6 positive COVID cases, 5 of which they're in fairly good health, and then 1 apparently died before she got her results. So we have technically 5 surviving COVID patients and 1 that deceased. But what happened was she went into the hospital, got checked in, fortunately succumbed to complications, and then the results came much, much later.
Mayor, yung numbers of persons, PUIs and PUMs?
They're actually very close to each other. As of 5 p.m. last night, we have around 99 PUIs and then 97 PUMs. But the numbers keep on moving as the hours go along. As we all know, we would get calls saying na meron dito, so we will send our epidemiology team. So the numbers keep on, number of PUIs and PUMs are actually very erratic. It keeps on moving.
Mayor, can you just tell us about your measures that you're implementing against COVID-19 also, as well as yung assistance naman to your constituents?
Well, 2 things. Diba, normally there would be the humanitarian side, the relief side, and there will be the medical side. Let's talk about the relief side first. Siyempre, putting food on the table in these trying times is very, very important. What the city did was to distribute food vouchers, around 110,000 food vouchers. Now, these food vouchers, they will redeem in 200 groups of 200 in all our 24 satellite city halls across the city. So meaning the redemption time, your voucher will have an individual location, a different time, and a different date. That way, we'll make sure na walang convergence. We'll make sure na in every 2 hours, only 200 will have that type of combination of food voucher. And so far, we're almost halfway through the redemption period. All the vouchers have been distributed na. Siguro mga some left with us, which we will finish by today. But all the redemption is still ongoing. And so far, so good. Walang crowding, walang dumog, walang convergence. People go there, they get their boxes, and they redeem their vouchers, and they get their boxes, they go home. At least it's safe. Now, we're planning to move on to phase 2, which is another wave, but this time we're expanding it. We're trying to look at a global number of 140,000 from the 110,000. The targets kasi will be the near poor families. These are the minimum wage earners. Marami yan sa Valenzuela because factory-based kami. Number 2, the poor families. And number 3, the poorest of the poor. Yan yung mga 4 Ps. Now, these 3, from our data, it would be around 110,000 households. But when we did our house-to-house, nung dinidistribute yung food voucher, we stumbled on new enclaves of apartments na may mga minimum wage. So we decided to move it up to 140,000 for the next wave. The next wave is targeted to We are targeting to distribute the food vouchers hopefully by late next week or mid next week, and then the redemption the week after or even the tail end of next week.
Mayor, interesado ako dito sa ipapatupad nyo na automated contact tracing.
Yeah.
Can you tell us more about this?
Actually, hindi ipapatupad, pinatupad na. When we were planning for our, sorry, I was going to discuss what things we have been doing to help DOH with the medical side, no? Right now kasi, nung unang panahon, di ba, kukunti pa lang naman yung cases. So it's very easy to contact trace. Susulat mo yung data, you write sino yung nakausap nila, kailan. So, kaya pa natin. But now na nagsasurge na yung PUI, PUM, and we have growing numbers of positive cases, we decided na we wanted to automate it. Kasi we have 6 city epidemiology team. These are the teams that respond to calls. Let's say may nagsabi meron dito nga high risk, so we go there. There are 6. Now the 6 teams has 6 members, of which 2 of them are surveillance officers. They do the contact tracings. They're armed with laptops that are hooked up into a network wherein kahit na 6 teams simultaneous sa city naglalag, the system will prompt us automatically kung merong overlap. Remember, what we're looking here for will be the community transmission. We want to know if the cases being called into us are related to each other and are the relations local in nature. So pag may local in nature, the system prompts us na, look, case 1, kunwari, and case 5 are related by a certain person, then we know na merong community transmission na nangyayari. Then we can move accordingly. We can take on the IATF memo na we can put certain clusters, certain barangays in further lockdown. There are interventions we can make so that we can isolate further where the community transmission is. But right now, wala pa. None. We don't have community transmission except within the household. Like our 1st and 5th cases, yung household nila na-infect nila, but right now those households are in quarantine and we have watchers standing by the doorsteps, watching over them, making sure that they follow their quarantine procedures.
Mayor, in terms of challenges naman, kamusta po yung mga ospital nyo, and then will you be setting up isolation centers?
Yes, we have 2 central isolation units. One is our brand new drug rehab center that's never been used. Gagamitin pa lang sana this April 1 eh. But we commandeered it for this purpose. And the second is our Astrodome, our Coliseum. Both cumulatively will have around 140 to 150 beds. They've been checked by the regional epidemiology team of the DOH already and okay na sila for operation. So once the surge happens, no, and our hospitals can no longer handle the volume of cases, the PUIs with mild symptoms can be moved into these isolation units where they will be treated by medical practitioners of the city. Right now, if you ask us yung capacity ng hospitals, our DOH hospital, Valenzuela Medical Center, which is a COVID-accredited hospital, is already running in full capacity. We have 3 big tertiary hospitals here, FACMA, Allied, and City Care. They're all equipped to handle COVID cases. They are running very high, but they're still accepting naman.
That's good to know, Mayor. Dalawa pong mayor, si San Juan Mayor Zamora and also Menchie Abalos of Mandaluyong are under quarantine. Kamusta po yung challenge sa inyo as a mayor na humaharap din po kayo? Or do you even go out? Or
I do.
Yung challenge po sa
Actually,
inyo?
Kaming Kamanava mayors, the Caloocan Malabon na Votas mayors, atay na una na nag-quarantine before the lockdown because remember, we were in that same NLEX event where there was a positive high-ranking government official that tested positive. He didn't know at that time. So lahat kami, we all went to quarantine, yung northern mayors, the Kamanava mayors. But we're right before the lockdown, natapos rin yun. It comes with the territory. Ako, like I always say, I just have to practice precaution when I go out. Wear a mask, social distancing. I keep tabs on my temperature, no? Even if I'm not exposed naman. I go out because it's very hard to manage from the office or your home. I realized that nung naka-quarantine ako before the lockdown and we were doing the preparations. Sometimes you really have to be there to see it physically. Like itong food distribution, when we were sending out the vouchers, I had to see personally if safe ba yung mga nagdi-distribute, the pacing of the distribution, okay ba? And then the bigger challenge was nung i-redeem na nila. Remember, 200 lang per hour. So I was kind of apprehensive na baka may mga hindi sumunod, pumunta earlier, so magkakaroon ng convergence. So I wanted to see the design and the process at work, so I had to go out. I'm on my way out also right now because I have to go around the city to check on the 2 central isolation unit. We're really preparing for that already. So it's, as a local chief executive, I guess it comes with the territory. You just have to take precaution. I have to go out to manage the city well.
Okay. Thank you very much. And ingat din po kayo, Mayor Rex Gatchalian of Valenzuela City. This is The Source on CNN Philippines. Coming up, a story of hope. Health workers in Laguna are celebrating this patient for being the first in their hospital to recover from coronavirus. Find out more after the break. You're watching The Source on CNN Philippines. I'm Ruth Cabal, sitting in for Pinky Webb. We want to take a moment to show you this video from UniHealth Southwoods Hospital and Medical Center in Laguna. Take a look.
Stay healthy, Rami. God bless.
We don't know her name, but we do know this patient recovered from COVID-19. Right now, all that matters is that she got better. For now, such stories may be rare, but worth sharing because it tells us there is hope. According to the hospital's Facebook page, the patient was discharged after 2 negative tests. We also want to honor the medical frontliners who are out there caring for patients and saving lives. Thank you. Maraming salamat po sa ating frontliners. And thank you for watching us. I'm Ruth Cabal. This is The Source. Keep it here on CNN Philippines.